Start.
Hello, I'm Dr. Trivedi, a doctor working in this clinic. May I confirm that I'm talking to Miss Lily Reinhardt, 19-year-old sister?
Yes, doctor.
Yes, I reckon that you have been wanting to talk with me. Is this right?
Yes, doctor. I want to know about my sister. I have been phoned by your hospital, and they told me that Lily's condition is very bad. I don't know what happened to her. I came from a long distance, doctor. Actually, I am very worried. What has happened to him? How is she now?
Okay, I'm very sorry to hear about your distress now, and I can understand that you are very worried. Uh, may I at this moment please know that how much do you have idea about your sister's condition?
Doctor, we yesterday we talked with her, and at that time she was totally fine, and we don't know that what happened to her. And about a few hours ago, your hospital, called me, and as I am her guardian, so called me and told me that she has been admitted to the hospital and her condition is not good. This is far I know, doctor.
Yes, I'm sorry to say that as far as you know, it's quite right actually. So actually, do you know that where has he been shifted now, or where is she still getting treatment at
No,
this
doctor, I
moment?
don't know anything.
Yes, yes. So actually, let me explain it to you. Are you willing to hear from me what actually happened?
Yes,
Or
doctor, yes. I want to know that what happened to her.
yes, actually, when she came to us, uh, she had very high temperature, raised temperature, and there was also some chilling. Okay, and her consciousness was also not very quite good. Uh, are you getting?
Yes, doctor.
Yes, we examined her and checked some important parameters like his heart beating and also blood pressure, uh, his temperature. All of these actually showed that her body is not keeping up very well to the needs. Are you with me, or are you getting me?
Doctor, you are saying that her condition is getting worse.
Yeah, actually, at that moment when she arrived, uh, her heart was beating very quick, and her blood pressure was also not up to the mark,
Why
which
did it
means,
happen, doctor? She was totally
yeah,
fine yesterday.
yes, I can understand it. At this moment, it's quite difficult to be very sure about what have caused this. But uh, we are, there can be some possibilities. But at this moment, we are thinking that there might be some bug infection, which can, there are some bug infections which can uh, harm the body very quickly, and which can present in with this type of problems. However, we have already sent her blood for examination, and we hope to find out the cause as soon as the report comes. But yet, we are not very much sure what caused her condition.
Doctor,
Are you getting me?
cannot be a case of poisoning.
At this moment, we are not ruling it out totally as well. We have already sent some report or some tests, and we are waiting for the result. But so we cannot tell for sure at this moment. It can be poisoning as well, but at this moment, since she has some raised temperature, we are thinking more in favor of that. However, we are not quite sure before we get the reports.
How her condition is now, doctor?
Yes. Um, okay. Actually, since when I told you before that her heart was beating very fast and her blood pressure was not up to the mark. Do you have any idea about this condition?
No, doctor.
Okay. Would you like me to explain it to you?
Yes, doctor.
Okay. When such thing occurs, like the heart is beating very fast and the blood pressure is not up to the mark, it means that actually the whole body is not getting adequate blood supply very well. Are you getting me?
Okay.
Yes. And at that moment, we actually call it a term like shock. Okay. Are you with me?
Yes, doctor.
Yes. So that was her condition when we checked her, when he examined her. And so actually there can be some causes when this can occur, this low blood pressure and high heartbeat. We suspect that there has been some um, whole body infection involved. Okay, the infection might have spread throughout the body. So for her better treatment uh, and better management, we have shifted her to intensive care unit. Are you getting me?
Okay, doctor.
Do you have any?
I heard that the people in the intensive care unit usually doesn't live. Is my sister going to die, doctor?
Well, what you have heard is actually partially true. Uh, I cannot deny that many people who go to ICU do not survive. That's not false. But at the same time, I would like you to know that because of our rigorous treatment and management protocols in the intensive care unit, many people also come back very strongly as well. So at this moment, our prime concern is to treat her in the most effective way, and uh, trying to do that efficiently in the most efficient way. So uh, please don't lose hope. We are trying to do as much as possible. Are you getting me?
Okay, doctor. And you said that you are suspecting a bug infection. Aren't you doing anything from it, or are you waiting for the report?
Yes, I am getting you to it. Actually, at this moment, we have already started tre- uh, treating. We have already started giving treatment, suspecting that bug infection, and you can be assured that the treatment we are giving it is not harmful for her. Even if that diagnosis is not that bug infection, this treatment is very unlikely to cause any more harm to her, and we are already giving her the treatment. Are you getting me?
Okay, doctor.
Okay. And at this moment, uh, have you do you have any more concerns or any more questions?
Doctor, she visited our home about 1 week back, and my mother has a condition called rheumatoid arthritis, and for that she need to take some steroid tablet and methotrexate tablet. And I am really very concerned about my mother. Does she need to take any medication, because you are suspecting that she is also having bug infection? And my mother's doctor said that for any bug infection, mother is a susceptible. My mother is a susceptible person. So, what do you think, doctor? Do you need to take any precaution for her?
Yes. Usually, I can understand your concern, and it's very natural, and I highly appreciate your concern for your mother. Uh, Actually, usually this bug infection does not spread so easily, but yet, since your mother has a condition and she is getting some specific treatment, like you said, methotrexate, actually it can it decrease our body defense system. Are you getting me?
Yes, doctor.
So we will actually uh, inform the communication disease control team as soon as possible and get their feedback about it, whether your mother needs some specific precautions or not, so that her health is not harmed at all by your sister's condition. Are you getting me?
Yes, doctor.
Yes. Do you have any more concerns or questions?
Can I see her now, doctor?
Well, at this moment, I am going to talk to the ward master as soon as possible, uh, so that they can help you out in this matter. So, are you getting me? So that you can have a look at her.
Yes, doctor.
Yes, yes. Well, at this moment, may I just ask you some more questions?
Okay, doctor.
Okay. Since she is in the intensive care unit, she might. We are not suspecting anything bad at this moment, but there can be some machine treatment needed in the future. May I know that has your sister ever desired any wish how to be treated if her condition gets bad at any time in her life?
No, doctor. I don't
Okay,
know anything.
yeah, that's all right. And may I know that has she ever given any advance directive regarding her treatment or something like that? Although she's very young, it's unlikely, but do you know anything about it?
No.
Okay. Okay. And has she appointed any lasting power of attorney for in this matter?
No, doctor.
I'm very sorry actually to ask these questions, but as we find that some people think about it at a very early age. So I'm just asking it. Is it okay?
Okay, doctor.
Yes. And do you want to know about anything else?
Doctor, when you will be sure that what happened to her?
Yes, we have already. Yes, I can understand it. Actually, we have already sent the blood reports, and usually these blood reports usually come within the day or two. So I I think we will be very sure about it in the least possible time. And please don't get bothered. Actually, we are already treating her, keeping most of the possibilities in our mind. We are trying to cover most of those. Okay, are you getting me?
Yes, doctor.
Okay. And at this moment, may I just ask you in one more question? Although it's a difficult time for you, may I ask you that?
Okay, doctor.
Okay. And may I ask you that I think she is a college student, as far as I reckon. May I know that whether she lives alone or with other people or not?
She lives at a student hostel.
Okay. And actually, may I just ask you that do you know of anyone more having such problems recently or within this time period?
No, doctor.
Okay, okay, that's completely all right. I'm actually very sorry to ask you at this moment. And okay, and may I know that would you like to have any idea about anything more at this moment?
No, doctor. I just want to see her. I am really worried about her.
Yes, I'm going to talk to the ward master and nurse, sister or nurse, so that they can make an appropriate arrangement for you in the quickest possible time. Are you with me?
Yes, doctor.
Okay, and may I know that do you need any more help, any economic, social, any more help from us?
Doctor, I am actually worried that if I am here, I told you that my mother has rheumatoid arthritis and she is in best condition, and there is no one to take care of her.
Yes,
We
yes,
can
I
arrange
will.
for that, so
Yes,
that
we
I
will.
can remain here and take care of my sister. Time off.
We will involve. Okay.
Okay, what was your task?
My task was to explain the condition to her sister.
And what was the condition?
I think the condition was septicemia,
And
suspected till
what do
now.
you think? Have you been able to explain it to her?
I think I have explained it her up to a level because I have explained about her physical condition and why this has occurred. That like, the infection is likely to have spread throughout the body. and the raised temperature and all those issues that septicemia has usually, like low blood pressure and high pulse rate. I think I tried to explain it to her.
And have you been able to meet her concern or meet her question?
I was not able to finish it. Actually, I would like to involve the social
Whatever you
service.
have explained, have you been able to give her the clear idea or any idea about without any ambiguity?
Sorry.
Without any ambiguity, have you been able to answer all the questions? Hello? Okay, have you been able to explain her all the questions without any ambiguity?
Actually, we are not quite sure at this moment. It's suspected till now. So I kept a little bit of ambiguity on purpose, actually, so that because we are not quite totally sure at this moment. So that's why I did.
What was your answer when when the surrogate has asked you that? How is she now? Did you answer that?
Okay, no, I actually didn't answer that. I think.
First, initially, patient surrogate asked you that where is she now? How is she now? You haven't answered it and asked twice. How is she now? You even couldn't give her a better idea, or even couldn't give her any idea about her condition. Say, how is she now? Okay, I can understand that you are very concerned about her. So I am sorry for your sister's condition. Her condition is not so good. So she was not responding to our treatment at work, and for that we needed to transfer her to the intensive care unit, a specialized care unit,
Mm.
so that I could get your answer that where is she now and how is she, how is her condition. After that, okay, what happened to her? Why she is not good? What do you mean by that? Then you could give me answer that. Okay. And I asked you twice, and every time you were telling this and here and there, but I couldn't get my answer.
Okay.
And also there was another question asked by me, that is she going to die? Even the answer was not clear. Okay, there is chance of dying, but you haven't expressed it. You said, okay, don't lose hope. What is the meaning of that? Okay, actually this condition is very bad. The septicemia we are suspecting that is very condition, and she is not well responding till now to the treatment that we are giving. So I am sorry to tell you that there is a chance of dying. I am sorry for that, but we are trying our level best to improve her condition. Okay.
Yeah.
And also, you had a lot of time, but you haven't asked her if she need any help. You asked at very last stage.
Yes, yes, yes.
Okay, and she also asked that does my mother need any specific any medication or any that is like any prophylaxis. At that time, you could have asked, okay, how is her condition now? Does she have any symptoms? Then I could say no, just apart from the symptoms of rheumatoid arthritis, she doesn't have anything. Okay, we will assess this condition after your sister result come, and after that, if we need any prophylaxis or any specific medication for that, we will promptly inform you that. And in the meantime, if there is any emergency, then you can always contact the emergency department.
Okay.
Otherwise, everything was fine.
Okay. Okay.
So, do you want to add anything?
No, I just I don't want. I actually missed a lot of things here.
No,
Okay.
not lot of things. Just don't hide anything, because she's not
Mm.
responding to our treatment, so there is a chance of dying. You
Mhm.
admitted that yes, she can die.
Yeah, 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 yeah.
And also, how is her condition now? You should have told it without any ambiguity that okay.
Yeah, yeah, yeah. And when she asked whether it can be poisoning, was my answer correct?
Yes, there the diagnosis is not clear till now. So you are suspecting that this is a case of septicemia, and you haven't explained the septicemia in a good way. There might be some blood infection that has spread to the bug, and they are releasing some poisonous chemicals.
Mhm.
We are suspecting this, and this poisonous chemicals has affected your heart, affected her heart, affected her brain, so that she has become confused, affected her heart, so that heart cannot work properly, and heart cannot supply blood to the body properly.
Mm.
Okay, so in a simple word, you could have asked it. Even there are a lot of better ways to explain this condition, but you are telling a lot of things, but I didn't get anything from that. That what is septicemia?
Mm, 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 mm. Okay, that has been a very simple and easy explanation. That what you told. Okay.
Yes, you should have because they are not expertise in this field, so they will not understand septicemia what it can do. Just that is some bugs in the blood, and they are releasing some poison.
Mm,
They are affecting the heart. They are affecting the brain. They are affecting the kidney.
mm.
Whatever.
Yeah.
For this, she is developing this symptom, and we are trying to uh, treat this condition by giving her medications like antibiotics, fluids.
Yeah, yeah, yeah. Yeah, that's all. That has been very helpful.
So do you
Okay.
want to add anything?
No, I don't want to add anything at this
I
moment.
am stopping.
Okay. Okay.